I am your host, Gina Pence with the Harker Heights Chamber of Commerce. And today we have two special guests with us. We have Mr. Zach Dietz, who is the CEO of Seton Medical Center here in Harker Heights. And then we have VP of Operations, Anne-Marie McKenna, with Freedom Urgent Care. So I appreciate both of you being here with us today. I know that you guys are incredibly busy, and for you to carve out just a little bit of time to speak to the community, I am very grateful for that. So thank you. First of all, before I allow you to do some introductions, I just want to send you both a message that you can share with your team on behalf of the Chamber and the community. We are so incredibly thankful for you and your team for all the work that you guys are doing, being on the front line and dealing with all of this pandemic with COVID-19. I know it sent us all in a tailspin, and I will say our medical industry here locally, you guys have done a phenomenal job. So please share that and let them know that we are grateful. I don't think that we can do enough. So thank you for that. And thank you for being great leaders and keeping them energized and motivated, because I know it's challenging to go to work every day and see the same thing and feel like you're probably not getting anything accomplished, but let them know we are truly grateful. So thank you for that.
Thank you, Gina. I appreciate that.
Yeah, thank you.
You're welcome. So I know the community feels the same way. We're hearing it and seeing it. So I would like to kind of turn it over to both of you guys and allow you to kind of tell a little history about your position in the healthcare industry and tell us a little bit about the hospital and the clinic, the organizations that you're with, how long you've been with them, how long has the clinic and the hospital been open, and how many employees do you have? And Zach, I'm going to go ahead and start with you if you'll share that information with our viewers.
Yeah, absolutely. And maybe first, before I dive into that, I will just thank the community and the Chamber for all the support over the last 2 months now, as we've all gone through this COVID-19 season. We still have a bit of a battle ahead, but it is encouraging to see our community and our economy begin to get back to some sense of normalcy, albeit a new normal. All the support has been great. We've received so many donations, words of encouragement, signs out in the grass in front of the facility. Of course, a lot of food, and it really has made a difference. This is, something that as much preparation as we put into being able to respond to emergencies and disasters. We had not really planned for a virus like this to cause such a pandemic throughout the entire world. So thank you for the support. We've dramatically changed our operations to help protect the public and our healthcare personnel, our patients and our healthcare personnel. And so I know that's caused, quite a bit of required change that's not too uncommon from what you see just throughout the rest of the community, but universal masking policies and restricting the number of individuals in the facility, any non-essential visitors and guests. We've really worked to minimize the traffic through the facility, and we will continue to monitor the situation relative to how many COVID cases we have in our area and adjust accordingly as we go. So it's still a very fluid situation, but we have begun to get back to, as I said, the new normal. We've started to do some what are called elective procedures. A lot of those are not purely elective. They're just not immediately necessary to save someone's life, but we certainly have patients who are in great medical need of receiving a surgery or a procedure to help improve their health status and their quality of life. And so we're excited to be able to get back to doing providing some of that care. For the facility history, kind of get back to the question now. We're coming up on our 8th birthday here. We opened up in June of 2012. I know it seems like just yesterday. I started here in Harker Heights originally as the assistant administrator in August of 2012. Our clinic, Wellstone, opened around the same time. Got started a little bit before the hospital opened up, and it's just been a tremendous 7.5, as I said, going on 8-year run here. We've seen incredible support from the community, growth throughout all of our facilities, especially this last year. We went through a lot of change and transition in 2019, converting to Epic, a new EMR that's got a lot of benefits for our patients and for our facility, and saw double-digit growth in practically every department. So, a really busy year last year that helped get us to a point where we're thinking about continued growth and expansion of our physical plant. Here we've been pretty consistent in terms of the number of clinics that we're running and the physical space that we're using inside the hospital, but we pretty much filled it up last year, and so that's exciting to start some of that planning. We have a third floor that's shelved space. Some of you know the third floor that you see from the highway. If you look through the windows at night, sometimes you can see that it's just shelved space. Looks like a basement up there. So beginning to think about what that might look like as a part of our hospital that we actually take care of patients in the near future. And then, of course, I'm joined by Anne Marie today here, and that's just been for the Freedom Urgent Care partnership over these last few years has just been so incredibly successful from our perspective, and Anne Marie and the whole Freedom team are just such great partners.
Thank you, Zach. Thank you.
Absolutely.
Absolutely.
Zach, thank you for that update. And, I will say from the economic side, we're very grateful for the healthcare industry. It has changed the dynamics tremendously in the city of Hawker Heights. And, that is to you guys and everyone else that's in our community helping and making that industry so much stronger. So we look forward to all the great expansions and growth that's going to continue coming. So, Anne Marie, if you'll kind of share a little bit.
Sure. So we actually just had our 10-year anniversary. April 20th was our 10-year anniversary of opening our doors. Fantastic community, Hawker Heights. It's wonderful that we can say that we've been here for 10 years, and the growth that we've seen. People didn't understand what urgent care was when we first opened our doors. So it was a lot of education for the community in and of itself. And we were there watching the hospital next door. We were there watching Seton when it was being built, and how great it was for us when we were afforded the opportunity to have a partnership with Seton in 2017. So we've had that partnership for 3 years now. And it goes out to the community, to Zach and his team as well, to the chamber, everybody coming together to recognize what's needed in the community, how to work efficiently together as a team. I feel as Zach does that it's just been a great relationship and a great partnership. And we have some exciting programs that we're putting in place, some that have been in place. We have a workplace safety program that we've always had, and that's a workers' compensation management program. We're building on that now. We're bringing in a designated doctor program this year, which will help the community employers as well. We're bringing in, to the urgent care side, we're bringing in respiratory fit testing. So that's a program that will not only benefit firefighters, police officers, it's going to benefit all healthcare workers, contractors, people who work in the airline industry as mechanics, anybody who has to wear a full and half-face respirator. We are now going to be one of the very few areas in Central Texas that does respiratory fit testing on site, so on our site in our clinic. So we're very excited with a lot of these upcoming additions to our practices. So, but yeah.
I think that's great. And again, you know, it kind of puts us on the map and in so many different levels as I'd love to say Team Harker Heights, because it's not just the city and the chamber, it's all of our businesses, all the industries working together to showcasing and let people know what we have to offer here in the community. So that's exciting news, Anne Marie. So thank you for sharing that with us today. And you both kind of touched upon, you know, that next question that I wanted to ask you, but I'm still going to ask the question because there might be a few things that gives you the opportunity to kind of dive in and share a little bit more. So, you know, what are some of the new programs that you have rolled out? And it doesn't necessarily have to be during COVID-19. Obviously, that has been a huge impact, and that has forced us to really kind of push out some mechanisms that maybe we weren't quite ready to do, and they had to be implemented quickly. But what are some of those programs that you think is a huge benefit to our community? And Zach, I'm going to go back to you first with that question.
Yeah, absolutely. You know, obviously, having the hospital and our medical office building where so many of our clinics are located at here in Harker Heights is a great benefit from an access perspective for our community and specifically the residents of Harker Heights. We've continued to expand though off this campus since we opened. So we now have clinic locations, a couple in Killeen and one in Belton, and continue to evaluate expanding throughout the region. Just because we know that we're providing high quality care, that we want to provide that access to other communities and towns throughout the region. From a program perspective, you know, we've got a couple of really strong partnerships in addition to the partnership we have with Anne Marie and Free Emerging Care. The YMCA, the Armed Services YMCA here in Harker Heights, is home to our outpatient physical therapy, occupational therapy, speech therapy programs. That's been a great partnership. It's a great location right in the middle of the Skipjaw neighborhood area and in Purser Park, so it's easy for a lot of our patients to get to. They know the location. For a lot of them, it's close to home, and that's so important from a therapy perspective, because you want to have those routine treatment visits and accessibility, ease of access, not making it a burden to have to come to the hospital and potentially deal with a more crowded environment, or certainly not having to have to travel far for those services has been great for our patients. And then our partnership continues with the Greater Killeen Community Clinic and supporting all their great work at the clinic in downtown Killeen. We help staff that clinic with nurse practitioner, provider, RN, and social worker. And it's a need that, quite frankly, I think we could do 5 times what we're doing today, and there would still be a large need in the community for those services. And so just continuing to work with now Jody, Nicholas, and the team over at the clinic, and helping to support them in their mission, making sure that we're doing everything we can to help support the entire community.
Well, and we appreciate that, and we know the need is there, and thank you for, stepping up and fulfilling that need, and we can't thank you again enough for that. And I agree with you. I mean, there is definitely a demand, and hopefully we'll see others kind of step up and participate and help as much as they can. I know they're always looking for volunteers, and I'm sure that each and every one of us are, open to that as well. So, Anne Marie, you kind of touched upon some of your programs that you've rolled out already. Can we talk a little bit about maybe some of the technology piece that's kind of into that as well?
Sure. So we had recently introduced some online check-in for our patients. And of course, with the COVID-19 pandemic, it almost forced everybody into changing their system. So if they weren't doing an online check-in, they had to figure something out to help take care of the community. So it almost enhanced what we were doing. So we do have the online check-in. It's paperless registration. Patients can sit at home and wait if they want to, and we can text them when, you know, that 15-minute leeway time to come in when the room is ready. But we also now have virtual visits, which we were planning to roll out this year. Well, we just stepped it up and we decided to roll it out now, which is great. So ages 12 and up, we now afford the community the opportunity to have a virtual visit with our providers. And it's been very successful. And again, you know, it's a community that if they want it and it's available, they're going to utilize that. And this does, you know, the patients still look to their insurance companies, you know, their payers, to see if they have that available on their plan. And if they do, you know, we're available to provide that service for them. And, you know, going back to what Zach said about, you know, looking at, you know, other areas and seeing where the need is for the community. And that's something that we're working with Seton we're working together with Seton on that as well. You know, other areas, you know, for urgent care, where can we help? Where do people need to have this care? Where do they need it most? So we're working together for other, you know, urgent care facilities in the community too.
Awesome. Well, you know, definitely it goes back to teamwork, no matter what level that we're talking about or what industry, that, you know, is the process of making everything stronger. So we appreciate that. And thank you for that.
Gina, I'll add, you know, and really a thank you again to the community and our patients, especially our Wellstone patients, very similarly to what Anne Marie described at the urgent cares. We've, you know, like I mentioned earlier, we weren't at all expecting to have to stop kind of dead in our tracks the way that we were providing care to our patients a couple of months ago. And so we've also rolled out e-visits and televideo conference visits, just using the same or similar technology to what we're using today. And I know that that's been a tremendous learning curve for our providers in Wellstone, really for us as a company, just to work through all the logistics and mechanics. And Anne Marie mentioned some of the you know, different insurance coverages and support of that type of technology in those visits, but really our patients, and asking them to prop up an iPad like I'm doing here today and work through a virtual visit with us on the fly. It's actually been a great experience, and I know we've all done it in our personal lives as well, with FaceTime and whatnot, to stay connected with friends and loved ones. But a big thank you to our patients who have been so patient and working with us as we rolled out new technology without really having the luxury of trialing it and perfecting it before we did roll it out.
Cool. That's wonderful. And, you know, as a patient myself and someone in the community, I mean, you know, we're all going through those technical issues and trial and error of beginning to use new services. And if it will allow us to be able to get in and visit with our physicians, you know, I think it's a win-win. Of course, it's like you both said, it's not going to be a fit for everyone and for every type of need, but what a great service to have that will help and benefit our community. So, you know, another thing I wanted to ask the both of you, and Anne Marie, I'm going to start out with you on this question. Is there something that you guys have put in place, kind of like the telemedicine that you just talked about, that you really see that need and maybe have the opportunity and plan on keeping that going forward to continue to use it?
Well, perfect example is the virtual visits. You know, it's been coming for a long time. People talked about it. And I think what had happened is, you know, a majority of people that have insurance, you know, if the insurance isn't going to cover that type of visit, well, they're not going to be able to utilize that visit. Well, now that the insurance companies are covering it, it's been, you know, I'll piggyback what Zach said, it's been great. You know, the patients have been wonderful. They understand that this is new for everybody. We would love to keep this program going, and we will. Now, will we have to modify it after COVID-19? And if the insurance companies decide they don't want to cover it anymore, yeah, we'll absolutely will modify it. There's other areas that we can work on and still have a virtual visit for the patients. So absolutely, that is one of the technologies that we will definitely keep as much as we can. The online check-in, that we will always have. You know, moving forward, there won't be any changes with that. I think if you think about what this pandemic has taught us, is back to the hygiene, right? Wash your hands, don't touch your face. Well, now people with the social distancing, you know, are we going to have to think about how our waiting rooms are set up, right? So are we going to, you know, have people in their cars more often than not waiting to come into the clinic? So these are things that, you know, the online check-in can easily handle that as well, just like we're doing now. Have them wait in their car. Somebody can come out to the car, bring them in when the room is ready. So I don't see the technology going away completely. I see maybe it changing a little bit for the time.
I agree. And Zach, what do you have to add to that?
You know, I completely agree with what Anne Marie said. You know, a lot of this technology is here to stay. I think from a healthcare perspective, a lot of this technology obviously was out there. You know, I mean, that's how we were able to sort of turn around on a dime and roll it out. And we weren't leveraging it for various reasons, whether there were regulations or reimbursement constraints around being able to really put that technology to use. And so we've cut through some of that red tape or some of those barriers, and we'll see. You know, time will tell what will be supported on a go-forward basis. But I think it makes a lot of sense. I mean, you have some patients who, you know, potentially have quite a bit of windshield time coming into town to see a doctor, and if we can save their time, if we can make it efficient enough, there's potential, you know, saving and finding some efficiencies in our operations and our providers' times and their schedules. I think that it's absolutely here to stay, and we'll just adapt to whatever the environment looks like. And some of the cautions and preventative measures around limiting the spread of the virus, again, you know, those have always been out there, quite frankly. You know, you think about flu season and washing your hands and not touching your face, and maybe even wearing a mask. 3 months ago, if you said you were wearing a mask at HEB because it's flu season, people probably would have, you know, thought that was a little funny. And I guess what this has done also is kind of cut through, you know, some of those perceptions and helped educate the general public. And I think over the next couple of years, as we continue to deal with COVID being out in our world, you'll also see, you know, reductions in flu cases and the spread of other diseases, as people are much more conscientious now about protecting themselves and even, you know, the social distancing. You think about airplanes and the talk about not filling that middle seat, you know, makes you think back again. Just use the flu season example. You got everyone packed in, you know, physically touching each other, kind of shoulder to shoulder, fighting over the armrest. You know, there's a lot of things that I think we can learn and use going forward to help keep everyone more healthy.
Absolutely. But, you know, and I know that we're closing in on our 30 minutes, but Zach, I just wanted to ask you one more question. Really just kind of a highlight. You guys have so many specialty programs at the hospital that you've rolled out. Anything from, you know, well, I know Austin Heart has been a big partner with you guys. So you guys have a lot of new updated techniques for so many different diseases besides COVID-19. Is there anything that you want to just kind of highlight before we wrap up?
Yeah, thanks, Gina. You know, a lot of work from the entire team on disease-specific certifications here. And I meant, you know, we talked earlier we'll turn 8 later this year. And in these first 8 years, we've just spent a tremendous amount of time and energy on ensuring that we're delivering care in the most current kind of best practice manner possible. So whether it's chest pain accreditation and being a 24/7 STEMI center, stroke certification, total hip and knee certification, our level 4 trauma designation, all those certifications and designations really mean what that translates to is hours and hours over years of time of highly specialized teams researching and learning those best practices, implementing them here in our hospital, and then really bringing in a outside third-party surveying body to ensure and validate that we have implemented everything correctly. And so all those gold seals of approval and certifications that you might see during normal times out on our electronic sign out in front of the hospital is really just reflective of the amazing teamwork and collaboration here within the hospital between our medical staff. You mentioned Austin Hart, and we have so many great medical staff members supporting our operations here, and then our nursing teams and ancillary teams, just everyone coming together and doing the best they can for our patients.
Well, we appreciate that, and I love the fact that you highlighted all those specialty and awards and accolades that you guys have received. I mean, there was some that I was not even aware of, so thank you for that. And Anne-Marie, any closing statements or remarks that you would like to make to the listeners?
Just again, I'm going to echo what Zach mentioned in the very beginning, just thanking the community for all of their support, thanking the Harker Heights Chamber of Commerce. I mean, anything that we've needed, we can call, and you've been there for us throughout all of this. And thank you to my staff and for being on the front lines, and of course thank you to the patients for being patient through all of this. It's hard for everybody. I mean, everybody's going through a certain a specific situation, whether they're sick or they know somebody who's sick, or they're just the anxiety levels. Everybody's been able to come together and just understand that this is hard for everybody, but we're there for them. We are there. So.
Well, I appreciate that. And, we're seeing every industry is doing a shift in their business model. I mean, and that even goes back to the chamber. And I know that the healthcare industry is very challenging because you guys are highly regulated. So I just wanted to share again from an outsider, your transition over this process, both of you guys, it has seemed incredibly smooth. I'm sure that you feel something different on the inside, but I just wanted to share with you. Great job again. And thank you guys both for taking the time to visit with me today and our community. And we'll make sure to share this up on our website, and you guys feel free to share it as well. We hope that you continue to be healthy, happy, and keep our economy strong. You both are doing a wonderful job, and if the chamber can help you in any way, please let us know. Thanks, guys.
Thank you.
Have a great day.
Thank you. You too.